Welcome to Tent Talks. I'm Missy.
And I'm Mariah. I'm a certified nurse midwife, and I'm a mom of 3 children, 7 and younger.
I'm a mom of 5, pregnant with my 6th. And we came together because we're women, just like you, and we saw a need. So we created a platform and a community for women called Beyond the Red Tent.
Right.
And we're taking it one step further.
To TED Talks. So TED Talks is a space where you can come and learn from vetted experts, real women that are willing to share their courageous stories about topics of holistic women's health.
And so you're here. We understand life is full. You're a busy woman. So this is only going to be about 30 minutes of a beautiful talk with either an expert or a real woman like yourself. So grab a cup of tea, sit back, and enjoy.
Okay, so Dr. Antoinette Falco is a naturopath out of Ontario, Canada. For those of you within the Beyond the Red Tent community, you've probably seen her before. You're welcome to do us. If you're in the Facebook group, do a search. You can hear a lot from her. And she also practices telemedicine worldwide. And so just keep tuned to the end. She's going to offer up a little free consultation and a visit for any of you that have said, oh yeah, I saw you on Beyond the Red Tent. Just mention Beyond the Red Tent and you'll get some extra freebies. So the thing that Antoinette is super passionate about is contraception. And, you know, many women love to have babies, and many women like to ideally plan when they have those babies growing in their body. And there's also the conundrum of which contraceptive method do we choose?
Right.
And so let's just start out. Let's just go right into it. What do you think about Depo?
Yeah. Well, can I say something at first? Because I know I get this reputation of being only for natural birth control and against all other forms, but that's not true, because the decision to choose a birth control is going to be individual, and it depends on so many lifestyle factors, so many factors. You know, where you are in your reproductive age, your willingness to handle side effects, your familiarity with methods. Like sometimes people just don't know the different types of birth control. Your health history, and of course, culture and religion. Like that's a big piece that starting to, come into the conversation. Not starting to has always been part of the conversation. So I just wanted to give that little disclaimer. And then now, why not Depo? So it's interesting because Depo, so it's injecting a synthetic hormone, progestin. And this is a huge myth that is within the contraceptive community, and that is that progestin is like progesterone, but we have to remember that it's not the same hormone. Progestin is a synthetic hormone that has a completely different action than progesterone. So progesterone produced naturally in the body, and it is responsible for implantation. It's responsible for promoting hair growth. It's responsible for decreasing the risk of a blood clot, and it's responsible for brain health. Versus progestin is used to terminate a pregnancy. It can increase your risk of blood clot. It can cause hair loss, and it can cause depression. So you're giving the body that progestin hormone, which then completely shuts off your body's production of progesterone, because that's just how they work. And the pros, I guess, for the Depo is that it's sort of you don't have to do them as frequently. You can use it while you're breastfeeding. Tends to be the common reasons that people would choose that route. But some of the side effects are very significant. And one of them being it can cause bone loss. And it's bone loss that isn't reversible in some cases. So that's a big one. Especially you think about women going on this when they're in their reproductive years, in their like 20s and 30s, and then just 2 years, maybe 25, 30 years later, they're in menopause, and like they already have low bone, they are predisposed already to low bone density, given that estrogen decreases in menopause. But then you were taking this medication that's aggravating that as well. So I think that is a big one. And then similarly to all hormonal contraceptives, which, have that risk of post-pill syndrome. And one of the symptoms is your period coming back either irregular or not coming back at all. I would say amenorrhea post-pill is quite common. And it's a bit frustrating because women are like, but I didn't get told this by my doctor. Like, how come, like, where's my period? Is this supposed to happen? So those would be, I guess, like reasons.
Okay.
One big side effect for Depo.
All right. Well, how about the combined contraception? So like your oral pill, the patch, the ring, the things that are where you're getting both estrogen and progesterone. Will you tell women a little bit about how are those being used, what's happening in the body, and some kind of pros and cons to that?
Yeah. So my favorite is when I hear I was put on the pill to regulate my hormones and regulate my periods. And I say, whoa, that's not what's happening. And that's a big myth, because the pill, or the combined oral contraceptive, I'll say the pill, it has those synthetic hormones in it that, similarly to progesterone and progestin, they're not the same chemical composition as the hormone your body produces. So what it does is it's sort of like putting a key in a lock that doesn't really fit well. So you can get it in, and it turns the pathway, but it's not the right fit. So it doesn't smooth, it's not completely smooth. That's similar to the effect with the pill, is like you're putting these like compounded hormones in a lock and expecting it to go perfectly if it was produced from your body. And the risk with that is that you're turning off your hormone production, and you're telling the brain and the ovaries, okay, stop talking. I've got this synthetic hormone coming in. It's going to do it's going to do the job. And that at first could be the answer to your prayers. You're like, oh, I don't have my acne anymore that I had. My periods are not painful. You name it, everything that you were put on the pill for. But we're not I hate the word fix. We're not addressing the root cause of what's going on. We're putting a Band-Aid on it, and we're saying, this is going to temporarily make things okay, which is dangerous for women, because then when they come off, they have these side effects that, the list is so long about what could happen in post-pill syndrome, around gut dysbiosis, around amenorrhea, which is lack of periods, around potentially putting yourself in a PCOS-like picture. So then here you've come off of a hormonal contraceptive, and now you're being told you have this other hormonal condition that you didn't even have in the before. Like, women are like, what's going on? And other signs of inflammation, like you can have skin rashes, you can have an increase in your acne, you can have joint pain. Like there really is no symptom that can't be linked. I mean, there are the common ones, but there are so many symptoms. And this goes to even while you're on hormonal contraceptives. So people don't often think about what their birth control when they're thinking about, oh, I have these migraine headaches that just like I get every day. And then like, you're like, oh, the pill, that's not really a medication. So when I ask about medications, they're like, oh yeah, like, no, I don't take anything. But then we trace it back and we're like, okay, nothing else changed. You started when you went on the pill. Or hypertension. I've seen that a lot. Like you start getting like really high blood pressure, and that's because of the synthetic estrogen that's in these combined contraceptions. You can have breakthrough bleeding. Yeah. So there's a lot that can go on.
There's a lot, it sounds like. And so what other options do women have? I mean, obviously, if you don't want to get pregnant, and abstinence is not what works for you currently, and obviously condoms are what are going to prevent sexually transmitted infections, and that's a whole nother conversation. Yeah. But if there's a male and female, a heterosexual couple that are in a monogamous relationship, they're not concerned about sexually transmitted infection transmission, and they do not want to get pregnant. Yeah. And a woman does not want the exogenous hormones being added to her body. What do you suggest?
Yeah, that's a great question. And I would say my answer to that is I really like fertility awareness method. I think its efficacy rates as high as 99.6, which if you look at the CDC, they just recently upped that to the second tier line of contraceptives. But that's with perfect use. So you get perfect use and you get typical use. So how to really differentiate, to make sure that you have perfect use, is making sure you're confident in the teachings, that you really understand the method. And that, to me, I have seen like the best effects if you work with somebody who's going to teach it to you, because that's the only way to really build that confidence and that mastery in your fertility, in your science of fertility. And perfect use,
right? You teach women?
Sorry,
I don't mean to interrupt, but you teach women. That's one of the things that you do as part of your telemedicine practice, correct?
Yeah. I teach women it. And what I also love, and this is like, a little added bonus to fertility awareness method, is it can be used for contraception, but it can also be used as a body literacy tool. And body literacy meaning you can get information about your hormone health and your overall reproductive health through your menstrual cycles and your charts. And I say this to my patients, I say, sometimes your chart is more informative than a blood test. And they're like, whoa, what do you mean? And it's because you're making observations every single day. And those observations are essential in mapping out your hormone patterns throughout your cycle. I do always confirm with blood tests, but usually I already know before the blood test comes in, like what's going on hormonally. And women are like, wow, that's so cool. Like that level of knowledge I never thought I needed. And you're like, yeah, it's really awesome.
And so what about demographics? Is this good for a woman who's 15, 25, 45? I mean, are there certain women that fertility awareness method is better for than others?
It can be used for anyone of any reproductive age, really, including like transition into menopause. So women don't often think about that, but we can see what's happening with hormones that way. The body literacy piece is huge there, and knowing like when ovulation stops. So that's I would say any age. If in terms of like the best time, I think when you're a young adolescent and you're just thinking about, I don't want any more exogenous hormones and I want to understand my body. I want to know my fertility now and I'm not ready for a baby. So I'm going to just use it as contraceptive. And then, in the couple of years, I want to be able to have the choice of, planning for my family. And so that's, a common, a common occurrence that happens where women want to learn.
So obviously, I'm sure there's lots of women with questions. You're welcome to post them down below in comments, and Dr. Antoinette Falco can be available to answer those questions. And obviously, anywhere in the world, if you would like to schedule a telemedicine visit, she offers free consultations. Can you tell us a little bit about the free consult and then what you're offering up to women after that? Especially, I imagine that there's a lot of women out there that would love to glean this information from the comfort of their own home in their timing anywhere in the world.
Yeah. So my call it's a hormone discovery call, which I use that. It doesn't always end up being 15 minutes. Sometimes it goes a little over. And that's because I really want to make sure that fertility awareness method is the right fit for you. And I want to understand where you're at currently with birth control. So a lot of that chat is really getting down to some of your health history, not super in-depth detail, but some of your history in terms of like, this is what I've been using. This is what works, not working. And then from there could be there's sort of two programs or avenues that I work with women. And one is in my Pill Freedom program, which is transitioning women off of hormonal contraceptives. So that window to get your body realigned, that's that program. And that does include some information. Like I do teach fertility awareness method in there because it's really important to know again, the body literacy piece of what's going on in your body before you actually might get your first period if you have, if you have amenorrhea after the pill. And then there's other women who, they want to just learn about their health, reproductive health. They want to learn fertility awareness method. They haven't used any other form of birth control. Or they're postpartum and they don't want to go on any birth control. then I will teach, it's just teaching them the fertility awareness method. Yeah. And with each of those calls, like I will say, an advantage to working with an educator is you get a bit more, you get that accountability, that hand-holding. You get somebody looking at your chart and being like, yes, this is a correct observation. Like, this is what this means. And that goes a long way to building your confidence and your understanding of your fertile phase.
And so how do women reach out to you? And we can also put that in the comments below. And then I know that part of that is free, part of it you do charge for. Which part is free and how does that work? And obviously, how do they schedule an appointment with you?
Yeah. So the best way is to send me a message directly through Facebook, or go to my website, just AntoinetteFalco.com, and you can send a message through there. Or there's also, if you download my myths about the pill and with a step-by-step guide on how to transition, I do have some good tidbits in there that'll get you started if you're thinking about coming off of a hormonal contraceptive. And then in that link, there's a link in that PDF that links you directly to booking in a hormone discovery call with me. And that call is complimentary. Like I said, it usually is about 30 minutes. And that's where we go over, is fertility awareness the right form of birth control for you?
Sweet.
And I've also started doing like group calls, which might be an option for women who want to, maybe there's a group of women that that all want to participate. Or typically it might be a more cost-effective option if you didn't want the one-on-one. Like, we can chat about all of that and what it looks like, because I think there is benefit to learning from other women in a group setting.
Mm-hmm. And remember to mention Beyond the Red Tent. I don't know if you guys, for those of you that have been with Beyond the Red Tent since the very birth of it, since the very beginning, Dr. Antoinette Falco has been with us from the very beginning, and she really believes in this project, and she's part of the community. She believes in the community. And so she is offering a little bit extra. So just make sure that you say, I heard about you through Beyond the Red Tent, and you'll get that consultation, and she'll give you that little bit of extra love, and you guys can work out what that looks like for the two of you. Remember, you're welcome to post any questions below, especially if they're specific to you. Please refrain from saying, I'll personal message you to any of the other women. The more we keep the conversation here on this thread, everyone benefits by having the conversation. So I commend your courageousness and your vulnerability to share something that's personal if you're open to that. And myself and Antoinette will be available over the next few days just to comment and chime in. And we'll make sure to post in the comments her website and just reach out to her via Facebook as well, or here on this thread. Okay. Any last parting thoughts regarding contraception and fertility? I mean, obviously there's the whole thing of detoxification after the fact, and that could be another conversation, but anything else you want to add?
Yeah, if you're, wanting to learn more even about fertility awareness method, I would direct you to going to a website that's called factsaboutfertility.org. And they go through all the different types of fertility awareness method. So, because sometimes women just want to be curious. They just want to know, they want to get informed. That's a big motto for me, and a personal philosophy is ask questions, be informed, because the choice is up to you and there's no right or wrong option. It's whatever feels right for you. So those would be my parting words, Mariah.
Yes. Well, thanks everybody, for everyone who's watching this on YouTube or the Facebook page or the Facebook group. There's so many other options. We thank you. Thank you for your support at Beyond the Red Tent. And thank you, Dr. Antoinette Falco, for your time and continued support of this community and this mission. And just look forward to more.
Thank you so much.
Thanks,
Bye.
everybody. Aloha.
Don't forget to subscribe.
And if you also want to take a peek at our website, it's right here.